So an interesting thing about being a breaker is you have to be able to adapt to a lot of different situations. So if I go into an ENT room for a minute to give a lunch, I have to be prepared for an 8-year-old ENT case. If the next break I go give is a thoracic double lumen tube, I have to be prepared to jump into a sick older patient with cardiovascular disease, with lung cancer, and they're doing a lung resection, things like that, and I have to deal with those kind of issues. Then I jump into another room and it's a robotic apectomy or something. I have to jump into that kind of setting. Then the next case I go give a lunch to is a total knee replacement, so I'm in that situation. So you have to be pretty comfortable jumping to a lot of different types of cases, a lot of different types of patients and pathophysiology, and you have to be comfortable with dealing with handling other people's anesthetics. So when you're breaking someone for 30 minutes for their lunch, it means suddenly now you're responsible for managing and taking care of somebody who's a different provider selected all the drugs, the setup, they put the spinal in, they intubated the patient, whatever, they put the block in. You have to kind of manage it. So some people may choose a very different anesthetic technique than you would have chosen. So you have to be very comfortable jumping in and taking over different diverse sets of cases and anesthetic types. So yeah, being a breaker sounds like an easy time, but in anesthesia, it's not necessarily easy.